I'm going to introduce Rachel Sumner, who is our next speaker. And Rachel is going to be talking about a very important subpopulation, which we are all very well aware of. Sorry, I just need to firstly make her. Rachel, can you please share your video? Okay, here we go. Hello.
Hi.
Yeah, Rachel is going to be talking about how the frontline workers, health workers, have been coping with this very stressful population. So yeah, without further ado, I will leave the floor to you, Rachel.
Thank you very much, Baha. Can you see my screen all right?
Yes.
Perfect,
yes.
Thank you. So first of all, just want to say a really big thank you to Merle and to the organising committee for this fantastic conference. I'm really looking forward to seeing all of the talks that are going to be happening over the next few days. No small feat to put this all together. So I'm going to be talking to you today about the first study from a project that my colleague, Dr. Elaine Kinsella, and I have been running since March, which has been looking at the health and well-being of frontline workers. As a bit of context, I'm in the area of health psychology. I'm a psychobiologist. Unfortunately, due to the pandemic, the psychobiology work has had to take a little bit of a back seat because we can't collect blood or saliva anymore. But I am still very interested in stress. So that's where the interest for this particular topic has come from. And Dr. Elaine Kinsella, my fantastic co-author, is an international expert in heroism, which is a really interesting area. So that's where this project came from. So we wanted to understand basically how the frontline are getting on, how how they're coping, how they're dealing with being on the front line. So as a bit of background for you, obviously alongside the traditional frontline that we see of medical staff in pandemics, we also see the rise of a brand new frontline in COVID-19 who are risking their health every day. Supermarket workers, postal workers, delivery drivers, teachers who are going into schools to look after the children of key workers, police officers going out to into the world, also armed forces officers who've been helping manning test stations, a whole new sort of sector of frontline in a health situation. Traditionally, we often see a certain type of person, particularly in medical frontline. They tend to be very high on altruism. They are a sort of specific type of person who feels almost a calling towards that type of work. But obviously we have a complete different type of frontline as well. We have our very critical healthcare workers. We also have these other types of frontliners as well. So we were interested to see, what they look like, but also how they're getting on. And obviously across the world, all of these frontline workers in whatever sector they happen to be in were experiencing extremely strange and very stressful conditions. And unfortunately, we have seen quite a few frontline workers since the pandemic started taking their lives. In terms of the context in our corner of Europe, so UK and Ireland, the types of stressful thing that we would expect frontline workers to be experiencing, obviously in health and social care, would be to witness the sickness and have to support people who are dying, having to make difficult choices, particularly in the earlier stages of the peak pandemic, where we were struggling with things like PPE and the provision of ventilators. But we're also seeing an entirely sort of new section of stressors for these individuals. So the experience of hoarding and the fighting that we've been seeing in supermarkets over toilet roll and bottles of water and what have you in the last few months. Some of these very sad sights that have been experienced, particularly by supermarket workers. So seeing elderly or vulnerable people in the middle of shelves that are completely empty, unable to get anything for themselves because people have been hoarding. We've also seen the weaponization of coughing either as a point of almost political defiance or as a defense mechanism or an offense mechanism, in the case of where we've seen people coughing on police officers who've been trying to arrest them. And those people who are just coughing at other people because they are generally in denial of the pandemic, which is also something which has been I would imagine phenomenally stressful for the people on the front line, having to witness all of these terrible aspects of what's been going on, and also hear that people don't believe it, that they don't think it's happening, that they don't think it's that serious. We also in the UK in particular have seen huge crowds over the last 4 to 6 weeks when the weather has changed. This is one of our beaches a few weeks ago. So we were still in lockdown that people flooded to, despite any assurances that it was not safe to do so. We also have this guy here. Some of you might recognize him, some of you might not. He is a special advisor of our government, and he, after having realized that he may have COVID-19, decided to flout all of the rules that have been put in place about lockdown and drive a 250-mile round trip in order to, and many more trips besides, in order to basically suit himself, whereas the rest of us were, maintaining our efforts to stay at home where at all possible. And then we've also seen these guys as well. So people who, then there's this whole rise, particularly in the UK, of the hashtag KBF, which is Keep Britain Free, who are very anti-lockdown, very anti-mask, very anti any sort of measure to try and prevent the spread of the infection. And you can imagine, not only do we have people who are seeing the infection and seeing the sort of human fallout from that, but also having to deal with all of this as well must be particularly difficult. So in terms of our study setting, it became quite clear very early on, I'm sure most of you will have appreciated this for some extent, that the government of my country was adopting a particular strategy that was quite different to others. So it has been sort of widely hailed as the herd immunity strategy, whereas others have gone for containment and suppression. So as a brief timeline of where we started, the 11th of March, the World Health Organization declared a pandemic. The 12th of March, the Prime Minister of the UK said that anybody with symptoms should self-isolate, but there was currently no evidence to suggest that public gatherings should be stopped. And the Republic of Ireland, the Taoiseach Leo Varadkar said that there would be an immediate closure of schools and colleges, daycare centres, and that any public gatherings should be limited to less than 100 indoors and less than 500 outdoors. At this particular time in the UK, the statistics were that we had 590 infections, and in the Republic of Ireland, we had 70. Fast forward a few days, and the UK in the week of the 16th of March hosts the Cheltenham Festival, which is just around the corner from where I live, which is a horse racing festival for the Gold Cup, which was attended by 250,000 people over the 4 days. International travel was still going on, so we not only had the people travelling from around the UK to do this, we also had people coming in and out of the UK. There was also a large stereophonics concert that was held in Wales, and the Champions League tie game occurred in the north of England. And just in case anybody's curious, I don't know if you can see that because the picture is over. I'm gonna have to scoot you onto the other side of my screen. Fast forward 2 weeks and the UK infection rate accelerates up to almost 20,000. However, meanwhile, over in the more perhaps sensible side of the Irish Sea, the Republic of Ireland took the very brave choice at that particular time to close down all pubs, bars and restaurants. And I say this is a particularly brave choice because this is very shortly before St. Patrick's Day, which is the largest day, but all of the parades and such were cancelled as well. So it was a particularly brave choice to make. And deaths across the UK and Ireland from when the pandemic was announced up until the 15th of May, which is when our particular data collection for this study in particular finished. This red dotted line heading off into the stratosphere here is the infection rate of the UK. This orange dashed line here is our mortality rate. Below this is the infection rate of the Republic of Ireland, so that yellow dashed line. And this green dotted and dashed line just floating above the x-axis here is the deaths that were observed in the Republic of Ireland. So quite different strategies with perhaps very different outcomes. The context of our specific study We started data collection here on the 30th of March, so quite quickly after lockdown started and quite quickly coming into the peak pandemic phase. We finished data collection for this particular study from the project on the 15th of May, and I'll talk more about what else is happening in the project a bit later. So as I said before, we very quickly put together a survey-based study, and I owe very big thanks to our Research Ethics Committee for accelerating that so very, very quickly, because we were able to mobilise it extremely fast. We set up the study with a longitudinal framework with the option for participants to opt into being resurveyed every 2 weeks, and also for the option of qualitative data collection as well, to do some interviews. We're also going to resurvey them then at 6 months, and then at 12 months, possibly 18 months as well, if possible. Like I say, it was a mixed methods design, although the survey itself was quantitative. We're also, and we've already started, and almost actually at the conclusion of our first wave of qualitative data collection as well. We wanted to recruit any and all frontline workers in the UK and the Republic of Ireland. So it's important that we just try to get as many people as possible from a lot of different sectors. And in terms of what we looked at specifically for this study, we collected their age, gender, their partnership status. So that was to be a proxy of social support. We also, these 3 measures we looked at are associated with heroism. And this is where the expertise of my excellent colleague, Dr. Kinsella, comes in handy. So altruism, levels of meaning in life, and levels of resilient coping. In terms of factors that relate to the pandemic, we captured where they were residents, so if it was the UK or Ireland, and we also asked them to rate their perception of their specific government's response to the pandemic on a scale of 1 to 10 on whether they thought it was timely, effective, or appropriate. We also asked them whether or not they themselves had experienced COVID-19 infection, or whether they thought their family, their friends, or their co-workers had. And this is particularly a bit of an interesting variable. I'll come onto it a little bit later. We've had to operationalize it in a few different ways, because I think we can get a few different interesting bits of information from there. In terms of the outcomes we're specifically interested in for this study, we wanted to assess levels of resilience, burnout, and well-being. So resilience by the brief resilience scale, burnout by the Bergen burnout inventory, and well-being with the short Warwick Edinburgh. Oh, don't know why that's gone backwards. Obviously pressing the wrong button on my mouse, sorry. So for our analysis, we looked at overall summary statistics, and we looked at bivariate differences between the UK and the Republic of Ireland as well, to see if there was anything sort of different going on in the samples of frontline workers that we had there. Multivariate, we looked at overall model fit for each nested outcome. So first of all, we looked at resilience, then we nested resilience in the next model, which was looking at burnout, and then we nested both resilience and burnout to look at well-being. We looked at this in terms of, first of all, personal factors and then pandemic factors, and then we stratified full models, including all of the variables by country, to assess whether different variables had different sort of weights of importance, depending on the country the sample came from. So we had 1,300, just over 1,300 people sign up who were eligible for this particular study. 66% of those were from the UK, very much largely female, very much largely from health and social care. But of the minority sample of non-health and social care, we did have a really nice profile of lots of different types of workers. 60% of those had caring responsibilities. Of those that had caring responsibilities, the vast amount were for just children, and 66% of them had a partner as well. In terms of whether or not they were certain, so this is where I was talking about before about the operationalization of this understanding of whether or not they'd been infected. We asked them if they themselves, their family, friends, or co-workers had been, and we asked them to say either no, I don't know, yes, formally tested and diagnosed, or yes, not formally tested, but I'm certain of the diagnosis. And this was partly because certainly at the time when we set up the study, and sadly still today, we don't have a very firm testing strategy. Certainly in the UK, the Republic of Ireland's testing strategy is certainly a lot more up to speed than ours is at this stage. But when we started, there wasn't really much going in the way of safe testing. So we wanted to understand not just whether or not they thought they'd had it, but also whether or not they were certain about it, because obviously with the understanding that if they weren't sure if they'd had it, that could be an extra stressor. So how this, and I've split this up just in terms of no, I don't know, and yes, for the sake of this particular presentation, you can see that they're, in terms of themselves and their family, the overall majority are saying that they haven't had COVID infection. However, when it comes to their friends and their co-workers, that kind of swings in the opposite direction, and they seem to be much more certain that their friends and co-workers have experienced COVID infection. In terms of comparing the samples from the two different countries, the psychological variables were pretty equivocal in terms of altruism, meaning in life, and resilient coping. Not very many differences there. The UK workers as a whole tended to have lower well-being than those who were based in the Republic of Ireland, and these were also lower than population norms as well. The UK-based workers rated their government response as less effective, less appropriate, and less timely, which is not hugely surprising, than those in the Republic of Ireland. And the certainty around whether their family, their friends, or their co-workers, so every single one of those questions, had experienced COVID-19 was significantly higher in the Republic of Ireland. So a lot more confidence in the sample in the Republic of Ireland about whether or not they'd experienced their infection with COVID-19. So looking at the personal and pandemic factors, in terms of resilience, what came through as being important there was pretty much just personal factors. So having presence of meaning of life and resilient coping were positively associated with resilience, and still searching for meaning in life was negatively associated. For burnout, we also saw both personal and pandemic factors being important in predicting this. So having a partner, needing to search for meaning in life, and having some sort of certainty that they themselves had experienced COVID-19 seemed to have a negative effect on burnouts. They were positively related to higher levels of burnout. But having presence of meaning in life, having higher levels of resilience, and government timeliness being rated as higher seemed to be protective against burnout. For well-being, we also saw both personal and pandemic factors being associated with that outcome. So again, having presence, so you can see there's a pattern, definitely a very strong pattern coming through here, having a presence of meaning in life, having a good level of resilient coping style, also having a good level of sort of current resilience, and having a perception of their government's response being quite timely, were all associated with better levels of well-being, but burnout was negatively associated. So when we come to comparing countries for the whole sample, resilience, burnout and well-being were predicted much more strongly by personal factors in both the UK and the Republic of Ireland, particularly meaning in life and levels of resilient coping. However, in comparing the UK workers to those in the Republic of Ireland, whilst personal factors are as important in each step, so the resilience, the burnout and the well-being, in the UK-based sample, the judgment of the government's timeliness seemed to be a key driver in all outcomes, to the point where, because the UK was seeing, judging the government's timeliness to be significantly lower than the Irish sample, this was also coming through as importantly predicting resilience, burnout and well-being. In the Republic of Ireland-based sample, this was mostly carried by personal factors, but there was some uncertainty about whether or not they or their families had had COVID, and that seemed to play a part in both resilience and burnout. So a key variable that seems to be important in both samples in all of our outcomes is that of resilient coping, which is fantastic because this can be taught. So this tells us this should be a really important object of intervention for frontline workers. And this is really good news because this is something we can fix. Even though there are obviously people in the front line that aren't used to being in a supposedly heroic role, the same variables that predict heroic action and heroic behaviour appear to be important in the resilience and burnout and well-being of everybody in our sample. Meaning in life, either having it or searching for it, seems to be an important factor during these times. However, obviously our understanding of meaning in life can also be negatively impacted by seeing what's going on around us. Meaning in life is not something which is stable. It can be very much changed by our circumstances. So you can see that in the early stages of the pandemic, where people, certainly in the UK, we had claps for heroes, and there was a lot of talk about heroes and that how our NHS workers were, the heroes of our times. As those individuals working on the front line started to witness the, the crowding at the beaches, the government advisors doing things they shouldn't be doing, and the general sort of denial of the pandemic, you can imagine that probably has a really strong impact on their sort of understanding of their meaning in life and their purpose, if other people don't seem to value what the efforts that they're going to. So the perception of timeliness in the government's response appears to be protective in the whole sample. So when we're looking at both the UK and the Ireland subsample, it's protective in terms of burnout and well-being. So if we're seeing good levels of perception of timeliness, then both burnout and well-being seem to be a lot lower. However, when we split those into the two different subsamples in the UK-based sample, the judgment of timeliness, because it's significantly lower than Ireland, seems to be quite harmful, and it has a negative impact on all of our outcomes. Some pandemic factors seem to be more important for the UK-based workers or the Ireland-based workers, which probably reflects differences in the way that the pandemic has played out. Obviously, I gave it a small overview of some of the key differences in terms of sort of policy at the very beginning, but there have been some very important differences in the way that the two countries have tackled the pandemic as time has gone on. So, and this is the unfortunate conclusion here, is situated obviously in the context of the UK having proportionately higher morbidity and mortality. Our findings from this particular study also suggest that the welfare of our frontline workers is also suffering in comparison. The relatively slower response of our government to introducing effective measures to combat the spread of this disease has had obviously an impact on our mortality rate, sadly. And now we also find that it's having a potentially terrible impact on the welfare of possibly the people who are our most precious asset at this particular time, our frontline workers. These different strategies, so the herd immunity versus elimination, not only seem to have an impact on the health of the general population, but this also seems to seep through to the sort of general resilience and well-being of our frontliners. So what's next for the project? So our next study is going to be looking at this baseline data again. We're going to be looking at different sectors of frontline workers, so looking at healthcare versus non-healthcare, or hospital healthcare versus care homes as well. So we have a large sample of care home workers. The third study will be exploring the experiences of the frontline workers. So this is our qualitative piece, which we're starting to wrap up our interviews for now. The fourth study will be a longitudinal study looking at anxiety and post-traumatic stress disorder in our sample. We were very fortunate that of our 1,300 or so participants that signed up, at least 800 said they would be happy to be resurveyed again, which is fantastic. And the next study that's planned, although I should imagine we're probably going to get quite a few studies out of these data, but the next study from that will be looking at the wellbeing of frontline workers who are also in a caring role too. So just before I finish, I have to say a huge thank you, obviously, to our participants for taking the time to complete our study and for signing up to our follow-ups and to the interviews. Obviously, the interviews didn't start until May, but these people were filling in our surveys when they were, in peak pandemic time. So we are hugely grateful for their time. We're also very, very grateful to a number of others, particularly students who've been helping us. So we put this study together very quickly. We didn't get funding for it, so we just had to do it very rough and ready. And we got some fantastic help from students and who have helped not just with the sort of infrastructure of setting up the study, but also collecting some of the qualitative data and helping us with some of the literature gathering and general operation of the sort of social media side of the study as well. So a huge, huge thank you to them. So that's it from me. Thank you very much again for inviting me here, and thank you again to the organising committee for what is a fantastic conference, and I'd be really pleased to answer any questions that anyone has.
Thank you so much, Rachel. This was an amazing talk on a very important topic and fascinating study at such short time as well. So if anybody has any questions or comments, please feel free to put them on the live stream. I have one, maybe two kind of connected questions for you. It was very interesting for me that you mentioned how there was this difference between people, frontline workers, who are kind of ready to be heroes versus who didn't necessarily sign up for this but found themselves in this position later on. I wonder, given that difference between the government efficacy of the government's actions in the Republic of Ireland and UK, do you think there might be a difference between the countries of the subgroup who hadn't signed up to be heroes? So perhaps the people who were not necessarily in the healthcare sector, in terms of their meaning of life, resilience, and what was the other one? Altruism. Yeah.
That's a great question. Well, we did do some preliminary analysis on those variables in terms of the different sectors. But before I mean, we didn't find anything hugely different, actually, which was quite interesting in terms of altruism. So altruism is one of those factors which is really strongly associated with heroic action, which is why we included it in the study. Yet it's come through as not being very important at all, actually, in this, which is really interesting. But I can probably I think I can understand that in terms of that, you know, altruism can be helpful, but it can also be harmful. So whilst it may be helpful for some, it may also be being harmful for others, and that's why it might not be carried through to, you know, anything particularly pertinent, certainly in these analyses. But I think what's also quite interesting is this sort of the rhetoric. So when we first set up this study, because Elaine, my colleague, is an expert in heroism, we said, well, we'll call it CV19Heroes, because they are heroes, and that's you know, I think we should respect them for that and name them as that, because they really are. And it all went quite well for a couple of weeks, and then all of a sudden we started getting this really bad backlash from people going, I'm not a hero, I'm just doing my job. I don't get paid very much. I just do this because this is what I do. You know, people keep calling me a hero, but I don't get paid properly for my job and all this stuff. And actually, I think there's a real rejection of some of that heroism rhetoric behind it. And heroism also it's a really fascinating area. I can't pretend to know too much about it, I'm afraid. But it is very interesting, and it's one of those labels that people are very happy to put on others, but seem very uncomfortable taking on themselves.
Yeah, thank you. I think Domna, our other chair, has a quick question as well. So Domna, if you want to go ahead.
Hi, thank you. Thanks, Rachel, for the study and everything you showed us. Now, I have a very general question. I know you reported your data, you know, from the UK and Ireland, but I'm sure that it's the case worldwide. And do you have maybe, since you've worked with these people, do you have any message maybe you could give healthcare workers or others who are watching us and who have friends or family working there, based on the results, based on what you've found and what you've seen working with them?
Well, that's a great question as well. I wasn't expecting that. Well, thank you is my main message to all of them, because you know, I find it very difficult, actually, because certainly being in the UK and doing this particular study and looking at the differences between how we've dealt with things and how others have dealt with things, and it makes me very angry every time I see that graph. Every time I see, you know, the differences coming up here, it makes me very angry. And I also want to say sorry to our frontline workers, because they have been very let down, particularly by our government. I think in terms of helping them to look after themselves going forward, obviously levels of resilient coping do seem to be protective at pretty much every step. So if there's anything that they can do to speak to their line managers, speak to their organisations to get help in building up more levels of resilient coping, that will hopefully be helpful for future, if and when they happen, future waves of the pandemic and future healthcare emergencies.
Okay, thank you.
Thank you so much once again.